I'm going to call the meeting to order Wednesday, May 4th, 2022 at 2 o'clock, actually 2:01 p.m. And at this time, I just want to inform the board that we have our legal counsel with us, Brandy Quant, and she will enter, as well as our advisor, Jeanette Town. And I'm going to move our, it's our policy for meeting attendance, which is an action item. I'm actually going to move that to the top of the agenda due to the fact that we have a board member requesting to enter the meeting virtually due to medical concerns, but we must adopt this meeting attendance rule first and then proceed. So
you need a motion for someone to move that.
We do, but did you want to speak to the meeting attendance rule at all? Did everyone, it's in your packet?
We'll have to move it to, we'll have to do a vote to move it to the beginning and then we can discuss it.
Okay, so I need a motion to move it to the beginning.
So moved.
Dick Cooner, Tim? Okay. So any discussion about moving? None, hearing none, we'll go ahead and take the vote. All in favor, please say aye.
Aye.
Okay, opposed, same sign. So obviously, and have to move to the beginning of the meeting. Going on now to the resolution adopting.
Do we have to do a roll call to start the meeting?
I haven't gotten to the roll call yet.
Okay.
Attorney Kwan, should we do roll call before we proceed?
Yeah, do the roll call and then you can move on to the attendance policy.
Thank you. Okay, at this time, Dick Cooner.
Present.
Dr. Copeland.
Present.
Dr. Gorski. Dr. Giardini.
Present.
Tim Neighbor.
Yes.
Linda Stanquist. Present. Wendy Larson Bennett. Mariana Body present. Okay, so then we will go on to the adoption of the rules.
I would like to make a motion for the board accept the recommended policy for meeting attendance.
I need a second.
Second.
Okay, Dr. Copeland. Any discussion? Hearing none. All those in favor, please say aye.
Aye.
Opposed, same sign. So it has been approved. Now moving on to the request by Wendy Larson Bennett. She would like to enter the meeting virtually, and because of our new rules for meeting attendance, the board has to make a motion to accept her request. And if there's further need for more detail, you can submit a question regarding that. So I need a motion and a second.
So moved.
Second.
Okay, Tim. Okay, any discussion? Hearing none.
And if I could just add, so the motion would be to allow participation by remote attendance due to one of the factors set forth in the attendance policy pursuant to the Open Meetings Act.
Thank you for the clarification. So that is the motion.
That's what I meant.
Good. And I know Tim will second that.
Yeah, right, exactly.
All those in favor, please say aye.
Aye.
Opposed, same sign. Okay.
We will let Wendy into the meeting.
Or are you lucky, Wendy?
Hello.
Hi,
Wendy.
Wendy.
And then the minutes could also reflect that now Wendy has joined the meeting following the vote, then
Thank you.
she is remotely participating.
Thank you. Sorry, I got COVID. Don't ask.
No, you're not alone, but I hope you're doing good. Okay, so we had no requests for public comment, but we do have a presentation today, and it will be presented by Stephanie Kelswich-Roney from Chassis, the Doula program. So,
For those who are attending virtually, I will share the screen for the presentation.
good spot for me then, or, yeah. Let me know when you're ready.
Go ahead and you can just tell me when to click each slide.
Okay, perfect. So thank you for having me. Again, I'm Stephanie Caltagirone. I am my supervisor over at Children's Home and Aid. I supervise multiple programs, one of which is our doula program. We're super excited and grateful to have the funding from the board to support our programming. And I wanted to just briefly talk about what it is that we do, how we do it, and touch a little bit on some of our outcomes. I know that the board has set forth some expectations that we need to meet benchmarks, and I think that we're successfully doing that despite all of the challenges right now in the world. So if you could go to the next slide, our team, those funded by the board here, are myself as a supervisor. I have Brittany, who is a doula too. And Brittany has 3 years of experience as a doula. So she takes our higher level needs participants. So I'll talk a little bit more about what those needs are, but when we engage with our families, we're constantly assessing, particularly for mental health needs. Some others would be substance abuse and other significant trauma history needs. She has the experience to manage those higher level cases. And then Ash is my other doula. She's just been with us about 6 months and is doing a fantastic job for us. But those are the 3 of us that are part of the team. So our doulas are what we call community-based doulas. And what that means is that we are reaching out to individuals in the community. They are reaching out to us to work with them in a home visiting forum. We provide natural support. We work with natural support. So we look for strengths that families already have, being family or fathers or partners, and other family and friends that our mamas have that can naturally support them, and we try to build those things up. We educate, we support, and really work with our moms so that they are ready not only to give birth, but also to transition into parenthood. So we're not just working with our moms. Our benchmark is to work with 40 moms in the course of this grant cycle, but we are touching so many others: the fathers, the partners, the families, the little ones, siblings. The other part of our community-based doula program is the prevention piece. So we know that children do not belong in foster care. We know that kids belong with their families as long as they can be safe. And so we are at the absolute front end working with our families to strengthen the supports that they have, to identify risk factors, and to connect them to community resources to prevent abuse and neglect. My experience in child welfare over the last 20 years has been that the more work that we can do on the front end to keep these little ones in the homes with their parents, the better that everyone is in the long run. So again, some of the resources that we are connecting our families to are mental health services, domestic violence, substance abuse, homelessness resources, some basic need resources where they may need things like car seats, diapers, wipes, and formula, those basic need items that are essential to raising a baby, and then parenting support. So finding them not only educational opportunities, but also peers, people that they can relate to who are having the same sorts of struggles and that they can seek support with. When I was a mom, when I was having kids and they were little, it's hard. It's hard when you have a supportive partner and resources and those basic strengths. And some of our families don't have that. And so our doulas really connect to our participants and try to be that connection. Next slide. This is a brief video. It's about 2.5 minutes long. We're going to attempt to show it. And it just focuses on what I just talked about, that abuse and neglect prevention piece. Kind of the doing the work on the front end.
There was once a carpenter that lived by a river in the village near you. every day with his trusty hammer, he built boats out of wood. One day, as the carpenter was working, he looked out onto the river and saw a child trying to swim towards the shore. "Help," said the child, "the current is too strong." So the carpenter grabbed a boat and rescued the child. "How did you get into the river?" asked the carpenter. "I fell in upstream," said the child. The next day, when the carpenter looked out onto the river, he saw 2 children struggling to swim towards the shore. "Help," the children said. The carpenter called out to another villager, and together they rescued the children. But the next day, there were 5 children, and the next day, there were 12, and soon the whole village was busy rescuing children from the river. The villagers grew weary, and some of the boats started to leak and break from overuse. The carpenter worked tirelessly to repair them, but as the number of children in the river grew, soon there weren't even enough boats to get the job done. One day, the carpenter asked himself a question. Why and how are so many children falling into the river in the first place? So he bravely ran upstream to find out. There, he saw a big, windy village with many houses, and some of the houses were in a state of disrepair. And when the wind blew especially hard, the houses creaked and cracked, and things were swept out of them and into the nearby river. Sometimes what was swept up was children. The carpenter saw an old lady walking by. "Excuse me," he said to the old lady, "tell me, why are these houses so broken down? Why aren't these houses stronger?" "The people of this village want to fix these houses so that they can resist the wind," the old lady replied. "But we do not have the tools to do so, and the wind lately has been especially strong." "I can help," said the carpenter. And with the help of the old lady, he gathered the villagers, gave them his hammer, and taught them how to use it so that they could learn to make their houses strong when the wind blew especially hard and keep their children from falling into the river. Yay! Because you see, if we make the effort to go upstream and help build strong foundations there, we won't need to work so hard to rescue children downstream.
So obviously that just illustrates what I was talking about, that our doula program focuses on babies and moms and their environment prior to them even being born, so that we can do that strong foundation work with them before little one even comes into the world. Next slide. Baby.
Sorry, I'm just trying to do the next YouTube video.
Oh.
There we go.
Okay, so this is actually one of my doulas and her participants. I just want to be clear that, we are working with our families from 20 weeks gestation. So for that second half of their pregnancy, we are in the homes weekly. We are identifying, needs. We are simply there to listen to whatever it is that's going on with them. But when we get to the point of, okay, we're at 38 weeks, our doulas are on call for our families 24/7. So if mom goes into labor or just has a concern or a situation, she reaches out. Our doulas go into the hospital. They work directly with the doctors and staff to make sure that mom's birth wish is being carried out. She sort of has a plan, and it's our job to empower her to make sure that her baby's birth is exactly what she hopes it to be. They have tools and use other forms of support in the sense of there have been hospital restrictions ongoing, so you could only have one person, then you could have no people, and we're back to 1 or 2. So sometimes our doula would be on another location giving virtual support so that dad or some other family member could physically be there. So we have adjusted and adjusted and adjusted throughout the pandemic to make sure that we could still deliver services, but in the safest way. Our doulas stay with moms 2 hours at a minimum postpartum, and they are both certified lactation consultants. One of our big pushes is to get moms to breastfeed if they can, because we know that that is the healthiest start for little ones. And so we support them both in the hospital and then ongoing in that way. Next slide. Some other services that we provide in addition to the weekly home visits are, we have a prenatal support group. So that's the area where moms can connect to other moms who are going through similar things and find support. We also have something called a Partners in Pregnancy group. It was originally focused on fathers, but we do have families that have same-sex partners or just untraditional relationships. And so that group is a one-time group. It is being held virtually currently, which really just instructs the partner in how to support mom in the best way when she is giving birth. And we use lots of incentives. So we encourage our families to, first of all, meet with us, to attend some of these groups, to do like homework assignments and other things that enhance their program with us. And they earn things such as car seats, pack and plays, diapers, wipes and formula, clothing, that type of thing. Next slide. Just some of the benefits of doula work. Again, this is another family of ours, really a powerful photo that mom, allows us to use for the purpose of showing her strength and just sort of the sweetness of having dad there supporting her. She had twins that day. Anyway, this relates directly to the outcomes, better birth outcomes. So we are looking at decreased levels of postpartum depression. These things can be difficult to measure because we don't know what might have happened had we not been involved. We have several tools which we've provided to Jason and Kristen to make sure that we are providing valid data. Again, I talked about breastfeeding and stress. So maternal stress is another outcome that we really look at and measure. Where was mom at? What was her baseline when we met her? And where is she at after the birth? And making sure that we're providing those anticipatory supports to prevent, again, mental health crises or eventually abuse and neglect. I talked a little bit about some of the community-based resources that we use, mental health support, extended home visiting. So once we close a family out, we connect them to another home visiting program before we close them. Housing and employment services, and then the nursery, the Mother Health Crisis Nursery, which is another program that I supervise, which provides emergency child care for little ones 24/7 when their parents are struggling. Next slide. Just a few challenges. WIC was a huge window from which we got referrals, and when moms stopped going to the WIC office to get their WIC coupons, we had to adjust to that. That's all being done by debit card and virtual visit and that type of thing. So we've worked closely with the health department to find new and innovative ways to connect with the pregnant moms that are out there. It's always a challenge to establish trust with our moms. Many of them have not had good, strong, trusting relationships over the courses of their lives. I can't tell you how much this role of a doula is not just a job, it is truly a personality. And one of the things that we didn't move as quickly with as we would have liked was to fill the second doula role, but we needed to find the right person. We couldn't just put someone in that role. And then staying connected. Again, with all the pressures and things going on in mom's life, there are times when we kind of lose touch with her. But again, we put in place some different procedures to, reach out to her, to use incentives, and stay connected to her as much as possible. Next one. I think you have to click it again, sorry. This is just a couple of quotes from some of the moms who have come through the program. This is Ash, so she's our second doula, using something called a rebozo to provide what we call comfort measures. These are some of the things that we do as doulas, as well as we encourage family members to do to help mom progress in a healthy, comfortable way during her childbirth. I think we're almost there. That's little Alina, so she was born with us. Yeah, I hope I did okay. I talked as fast as I could. Any questions, anything specific? Yeah.
Yes, Ms. Kelton, really, and if I was, didn't catch this, please help me.
Sure.
40 moms is your tops that you work with?
So I believe the expectation for this grant cycle was to what's the word? Work with 40 moms, to have served 40 moms during the period.
Okay.
All right, so you talked about the risk factors. I think that was answered in your presentation. All right, how do you measure success then?
Sure, so
What
there
are the parameters you may use to see how this works?
So a couple of different ways. The first one, we use something called a Kessler 10, which is sort of a broad mental health assessment. And we use that right at the beginning to identify sort of the level of mental health that we might be working to manage. And that is when we will assess which doula the family gets assigned to. From there, we use a couple of other assessments, the Edinburgh, Edinburgh prenatal depression screening, sorry. And we deliver that at multiple times during the participant's time with us. So that measures levels of depression. And so our goal is to make sure that it either stays the same or that it goes down, that it never goes up. And if it does, then that's when we're going to get on it and make sure that we're making referrals, maybe see the family more often, get mom a break, those types of things. We also measure maternal stress, and that is a survey which mom completes for us, talking about her levels of stress in a way that isn't clinical, but just giving her some examples and how would you feel in this circumstance? Who would you reach out to? How would you manage? And again, that is delivered at least twice, so prenatally and postnatally, but potentially at other junctures if there were any red flags.
Okay, I guess, I'm sure this is pretty difficult, but what is your percentage of success with these programs?
Nearly 100%. I will say that is our moms who complete the program. So there are some who we lose track of, who stop connecting with us. That's a small percentage, but for the most part with the, over this last year, we have been close to 100% successful at maintaining contact and meeting those deliverables.
Where do most of your referrals come from?
So 2 places. One is the health department. So moms who go in and sign up for WIC. We have a coordinated intake person who is stationed at the health department who refers those moms out to different home visiting programs. Our agency and Easter Seals are the 2 that have doula programs. The other places, they call us directly at the nursery. One of the advantages of me supervising both programs is that someone is in the nursery 24/7. So we could have a mom call at 2 o'clock in the morning, and sure, we can talk about doula. We can talk about the program and how to get you, into the program. We also have several other community partners that we have formalized working agreements with: Crusader Clinic, the Family Peace Center, Remedies, the Pregnancy Care Center. So there are a couple of different again, community partners that help funnel pregnant moms towards us.
What's the caseload for an individual doula?
10 families. Of course, depending on whatever the situation is at the moment, it could go up to 10, it could drop down to 9, but our goal is 10 families.
And what, do you have good resources to hire additional doulas?
Well, the staffing crisis continues. I do have a spot on my team for a 3rd doula, and that is currently vacant. I, within Children's Home and Aid, which is a very large statewide organization, have recruiters who help me identify individuals who are qualified, and then we go from there.
Most of my questions have been answered except this one. The home visit piece, I believe I heard you say that at a certain point you sort of give a warm handoff to some other organization. What are the organizations that are doing the home?
Sure.
After you get there?
So I mentioned that I Grow Collaborative, which is part of the health department, and we have a coordinated intake person. And the other home visiting agencies, for example, YWCA, Easter Seals, the school district, they do early intervention services and can go into the homes and deliver something called the PAT, which is Parents as Teachers. So educating moms and dads on how to get their little ones ready for school. So those different organizations provide in-home services once little one is born and we're ready to close.
Just-
Okay, one more question.
Yeah, can I? Oh,
Wondering, what programs do you use for postpartum depression, and do you have any, clinical services for the moms?
Yes, so Children's Home and Aid does have a clinical behavioral health program. We can refer our moms to those programs. We also utilize Rosecrans, as well as some other, let me think, I guess Rosecrans is our big one. There's something through OSF called the Silver Cloud, and it is virtual therapy, which a lot of our moms are much more inclined to use, especially in an emergency situation. Obviously, if it were a situation where we thought mom was going to hurt herself or someone else, we would intervene much more, emergently. We'd make sure that her and little one were safe. But we do make those referrals to the community resources for mental health.
The other one is, do you provide services for the partner to help in the event of postpartum depression? So, some partners will leave at that moment once that come up.
Yeah, that's a great question. And we educate partners prenatally about postpartum depression so that they're kind of prepared and helping us look for it so that they can reach out to us and say, hey, I'm noticing this, maybe we should. And so we try to normalize it in the sense that it's not like something that's not supposed to happen, and kind of try to take that stigma away. But yes, all of our services are designed to wrap the whole family. And so if it's a sibling or a partner who needs the help, we are absolutely inclined to provide that.
Okay, I think we had, Wendy, did you have a question? And then
I was just going to ask if you have plans to accelerate the program into the next program year by expanding outreach.
So by expanding outreach, I don't feel like we've had a lack of referrals.
No, okay.
Okay. So that's not been an issue. It's more of, getting my good staff in place and keeping them sort of steady. We'd love to add more doulas to our team. That's certainly something we'd like to be able to do going forward.
Okay, awesome. Thank you.
Yeah.
all right. Any other questions? Otherwise, thank you very much. You did.
Thank you.
It was really nice to meet you all. Thank you so much.
Okay, all right. Moving on to the monthly activity report, we all received it in our board packet, but if there's any item, Jason, you wanted to highlight?
Sure, quickly, I'll just mention that the branded gear has been ordered and it's on the way along with the tablecloth so that we can get out to some of the community mental health expos that are happening throughout the community. I've been really encouraged by the number of organizations that are not even necessarily ones that we're funding, taking it upon themselves to really respond to the broader mental health crisis in our community and across really the country due to COVID, seeing more and more organizations wanting to connect people to resources. I know that One Body Collaborative is convening faith-based organizations for a mental health expo. I know that, I'm looking to you on this one, Mentality Unchained is hosting a forum at Nordloff this Saturday, which is going to really focus on connecting the Black community to mental health resources and having some local leaders, including one of our board members, to speak to mental health in the Black community. And so that's just two examples of a number that I'm seeing. There was a youth-focused mental health forum, I believe, that took place this week as well. So seeing them all over the community, and it's really encouraging to see the community response to this mental health crisis that we're in.
Thank you, Jason. Moving on now to our action items. we will need a motion and a second for approving the April 2022 meeting.
So moved, so moved.
Okay,
Second.
any discussion? Hearing none, all those in favor, please say aye to approve.
Aye.
Opposed, same sign. Okay. And the second action item that we will need a motion for approval, motion and a second, is the resolution authorizing the Winnebago County Mental Health Board funding and allocation of grant funds for new applications for program year 2022 and 2023. Whereas the Winnebago County Community Mental Health Board published a 3-year strategic plan defining priorities and target populations for program year 2022 to 2024, and released a notice of funding opportunity for program year 2023, requesting proposals aligned with the strategic plan priorities for up to $15 million of total funding. Whereas the Winnebago County Mental Health Board received 24 new request proposals totaling $10.1 million. And whereas the Winnebago County Mental Health Board members reviewed, evaluated, and scored the 21 applications according to an established scoring matrix that was published alongside the notice of funding opportunity, and developed recommendations for funding along with the work plans for each potentially funded proposal. Now therefore be it resolved by the Winnebago County Mental Health Board as follows. Section 1, that the Winnebago County Mental Health Board shall fund the following proposals totaling $6,658,358 contingent upon the execution of funding agreements and work plans. First organization is Boys and Girls Club of Rockford. They will receive $136,300 for the Youth Self-Regulation Program. Children's Home and Aid will receive $412,081 for the Winnebago County TRIO program. Circle of Change will receive $40,800 for the Circle of Change New First Responder and New Youth Class. City of Rockford will receive $2,005,136 for a mobile integrated mental health program. Crusader Community Health will receive $149,820 for Crusader Behavioral Health Services Expansion New FY23. Family Counseling Service of Northern Illinois will receive $232,969 for Service Expansion 2.0. Lifescape Community Services will receive $150,000 for a senior mental health program. NAMI Northern Illinois will receive $222,839 for support, education, and mental health advocacy. OSF Health System, DBA, St. Anthony Medical Center, will receive $300,000 for the OSF Healthcare Strive Trauma Recovery Center. Regional Access and Mobilization Project will receive $293,593 for mental health services and training. Remedies Renewing Lives will receive $339,792 for Renewing Lives Behavioral Health Clinical Project. Rockford Park District Foundation will receive $500,000 for unique mental health services through the development of the Lockwood Indoor Equine Center. Rockford Sexual Assault Counseling will receive $75,262 for outreach therapists. Shelter Care Ministries will receive $83,300 for the Jubilee Community Outreach and Housing Stability Program. Stepping Stones of Rockford will receive $500,000 for the expansion of supervised housing for adults with serious mental illness. Winnebago County will receive $394,230 for the juvenile detention program, reducing isolation through expanded behavioral health. Winnebago County will receive $187,961 for Juvenile Resource Intervention Center program behavioral health implementation. Winnebago County will also receive $184,130 for the Resource Intervention Center behavioral health expansion. Winnebago County Health Department will receive $160,569 for trauma-informed community care coordination. YMCA of Rock River Valley will receive $161,634 for protecting youth mental wellness. And the YWCA of Northwestern Illinois will receive $126,940. So I will need a motion to approve the resolution to authorize Winnebago County Mental Health Board funding and allocation of the grant funds for the new application for program year 2022 to 2023. Dr. Giardini and Tim. Okay, we've got the first and second. Any further discussion? Tim?
How was the conversation with the park district, and did we come up with any more defined mental health service agreements?
We have dictated in the special conditions within the park district's work plan, so the funding is contingent upon execution of the work plan, that prior to receiving any funding, they will have to submit a mental health program plan demonstrating, also with a contract demonstrating their multi-year commitment to mental health programming at the Equine Center, and a policy for how they will reimburse funds should that multi-year commitment not be met. And so that will come back to the board for an approval before any actual checks are issued.
Okay. Any further?
Jason?
Yes.
Could we get sort of the Cliff Notes version of the special conditions for any of the approved programs? So
Yeah, you have access in the folders that you have access to.
Okay, I guess I'm not.
The work plans are in each of those folders for the
Oh,
program
okay, all right, I see.
with the
Okay.
specific special conditions
Okay,
listed on the work plans.
okay, I didn't go, all right, thank you.
If you are having difficulty accessing any of them, please let me know. We're happy to send you a copy in your preferred format, including a PDF email to you if you need it.
No other comments? Okay, hearing none. All those in favor, please say aye.
Roll call.
Money,
Oh, that's correct.
Just raise your hand, yell out for three.
Dick Cooner,
Yes.
Dr. Copeland,
Yes.
Dr. Gorski, Dr. Giardini,
Yes.
Tim Neighbor,
Yes.
Linda Sandquist, yes, Wendy Larson Bennett,
Yes,
Mary Ann Abadi, yes. Okay, so at this point that we have adopted the resolution. Moving on to the FY 21-22 budget amendment.
Sure, we have one final budget amendment request from this program year, and I did not ask Rosecrans to attend this meeting because it is really a technical budget amendment based on our strict adherence to our policy. We allow in our funding policy for any line item that exists that a funded agency can potentially go over that item by $3,000. And if anything is over $3,000, then it's not approved or they have to do a budget amendment. We also indicate that if there's any new line item created, it requires a budget amendment. In this case, it's a technicality of language. Essentially, when they put all of their supplies into their line item, they labeled it as originally as info technology. And some of the supplies that they need to purchase do not fall into info technology, so like paper for office, for example. And so while they're basically asking to create a new line item for supplies and move $2,000 from information technology into supplies so that they can cover office supplies that do not otherwise fall into the information technology category. So it's really a technicality, but we wanted to keep strict adherence to the board's funding policy in all matters. So we really wanted this to come to the board for a formal vote to really adhere to the funding policy.
So you need a motion?
We need a motion
We need
to
a-
approve this budget amendment.
So, I move that the board approve this budget amendment for Rose Training.
Any discussion? Hearing none? All those in
Roll
favor?
call.
Oh, it's roll call. Okay,
Morning.
Mr. Cooner,
Yes.
Dr. Giardini,
Yes.
Dr. Copeland.
Yes.
Dr. Gorski, Dr. Tim Neighbors.
Yes.
Linda Sandler. Yes. Wendy Larson Bennett.
Yes.
Mary Ann Abadi. Yes. Okay, moving on, the next action item is, we've already done the meeting attendance, so we can move on to the resolution adopting a policy on advisors, and we received that in our packet, but Jason, I'll let you explain further.
Sure, I will do my best explanation and then defer to Attorney Quantz to step in at any point if I am not communicating this accurately. Based on prior discussions, we have the legal counsel has drafted a policy or a resolution and accompanying policy for advisors that dictates the terms of the first two advisors that were uniquely appointed as essentially through the county chairman and county board prior to the statutory authority being given to the mental health board through state statute with the amendments to the state sales tax law. So with that, this essentially is acknowledging what the roles and responsibilities of these advisors are, and that upon termination or resignation of these advisors, that those positions will phase out and not exist. Should the board at a future point in time wish to create a different type of advisory position, it would really likely, and again, I'm deferring to legal counsel on this, make sense to create a different policy and procedure for that, because the conditions under which that advisor would be appointed would be completely different than how these advisors were appointed uniquely through a chairman nomination and county board appointment. So that was the reason for landing at this final recommendation of when these two positions reach their endpoint, that they would not be renewed positions.
And this is an action item, so we'll need a motion in a second. A motion to approve, a second.
Second.
Okay, any discussion? I may enter at this point, just advise you that today Jay Ware did officially resign, and he wanted us to share this with the board. He feels that he fulfilled his role as an advisor, so he is resigned. So, no other discussion?
Yes, I have a question.
Sure, Jeanette.
Does that mean that my role as an advisor is phased out?
No,
No.
it does not.
Okay, I misunderstood.
Yeah, no, if you were to resign, then you would not be replaced, the same way that you were assigned.
Okay, thank you.
Sure.
I would like to see the board working towards consideration of a new procedure, because I think we need community engagement on different levels, and having people at our meetings, I think, is important.
And my recommendation would probably to start thinking about what types of community involvement you need, and maybe set up some subcommittees that would be more along the lines of what a board would do rather than appointing advisors. So maybe some subcommittees in areas that you think the board is lacking or wants to develop, or something, you know, some subject that you need assistance on.
That's fine.
Thank you. Okay, we have a motion and a second. Any other discussion? Hearing none. All those in favor, please say aye.
Aye.
Aye. Okay, thank you. And the last one is the adoption of policies and procedures. So Jason,
Well, this is really a formalization now of the resolutions that have already been passed. There was previously adopted a policy for anti-retaliation. You've now just today adopted a policy for meeting attendance, and the third policy, which was just approved, was that for advisors. This creates them now kind of as a formality, as a policies and procedures document, which will serve as Exhibit A as an attachment to the bylaws that were previously established.
so we do need a motion to approve the adoption
So
of policies and procedures. So moved, okay, second. Tim, thank you, Tim. Any discussion on that? Hearing none. All those in favor, please say aye.
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 Aye. Okay, the adoption of policies and procedures passed. So moving on, discussion items. I do not have any further discussion items. Other matters, there is nothing under other matters. So I
I
will
move to adjourn.
Thank
Nick, don't beat around the bush on that one.
He never does. That's second. Okay.
You hesitated, I saw that.
Yeah. Any discussion? Hearing none, all those in favor?
Aye.
Opposed? Okay, well, thank you all, and thank you for attending.
Thank you.
Yeah,
And this is
Two.
we have to
we
know
look
about
forward to.
right across the parking lot.
Bye, guys.